All right, so now we're recording. And so we're beginning chapter 13. So I'm going to go ahead and share the screen with you now for chapter 13. Okay, kind of the introduction to this chapter. This chapter 13 is on psychological disorders. So here's some different phobias, the phobias things people are afraid of. And I've always opened with these list of phobias for the past maybe 2 years. So this isn't something I rearranged today. This is what I've always done. So it's kind of interesting, the first one on the list. What I'd like you to do right now is open up your mics for just a minute, unmute your mics. And so I'm going to just ask you as we go through what each of these is and see if somebody knows what each one is. So the first one, misophobia, is something very prevalent for today. Can anybody tell me what misophobia is? I actually had something for you in classrooms when you walked in the door. So if you have misophobia, you could deal with it. And people are buying a lot of disinfectant. Wow, usually I could get somebody who knew what that was.
Is it like germophobia?
Yes, very good. Misophobia is fear of germs. Okay, xenophobia is not only a fear, but this term is used for a hatred of a certain group also. And one of our leaders seems to exhibit qualities of xenophobia. Does anybody know what xenophobia is? Xenophobia is a fear of strangers or foreigners. All right, triskaidekaphobia. There's a certain calendar date that may feed into this fear, certain date and day when it falls on the same time. I want to take a stab at triskaidekaphobia. Mathematical. What number is a bad number?
13.
Yes. So that's the fear of the number 13. And in fact, that fear is so strong that there are some buildings, especially some hotels that are very large, that won't number a floor, the 13th floor, out of the 12th floor and the 14th floor, because that's so strong for people. Okay, tonotrophobia. What's the root of that? What do you think that's the fear of? Didn't wake you up with that, huh? The fear of thunder. Pteromerhanophobia. What's the root of that sound like? So that first syllable or two, what does that remind you of? Somebody tell me the dinosaur that it looks like that relates to.
Pterodactyl?
Yes, the pterodactyl. So what would that be the fear of?
Flying?
Yes. Pteromerhanophobia is the fear of flying. So my sister has that fear. And so if she gets on a plane, she has to go to the doctor first, get a prescription, and take a little drug before she gets on the plane. So she's way calmed down. Photophobia. It's not fear of looking at my photos, but what would photo be?
Is it fear of light?
Yes, very good. Fear of light. And nyctophobia would be contrasting to that. So what would contrast to the fear of light?
Night.
Okay, yes. So either fear of the night or fear of the dark. My youngest daughter is 30 and she still needs to have a nightlight on. Necrophobia. Anybody know what that has to do with?
Is it fear of dead people?
Yes. Fear of death or dead things. Okay, the next one, catarrhatophobia, is a common fear that people might experience, especially if they don't keep their house clean, and that causes little things to appear. This one's happy, but usually they're not smiling at you. That's the fear of cockroaches. Okay, the last one you'd never get from looking at the word, coraphobia. However, it's something some of you exhibit in a small form, especially when you're taking AP classes or dual classes. You have a fear of this. What would you have a fear of when you're taking an advanced class? It's an F word.
Is it failing?
Yes, exactly. Very good. Fear of failure or defeat. Okay, so you guys can mute your microphones again. We're looking at psychological disorders now. Now, when we go through this, a lot of times you'll see things and say, wow, I kind of do that. Okay, we all exhibit certain degrees or symptoms of these behaviors. That doesn't mean you have a disorder. It becomes a disorder when it disrupts your ability to function. Okay, so we want to understand that. Okay, somebody might be afraid of crossing railroad tracks, and so when they go over railroad tracks, they get a lot of anxiety. That doesn't mean they have a psychological disorder. If they have to find a route and go an hour out of their way so they don't cross the railroad tracks, then that's a psychological disorder. It's disrupting their ability to function in life. If somebody was really afraid of germs and washes their hands a lot, that doesn't mean they have a psychological disorder. But if they are trying to leave the house and then they feel, I gotta wash my hands, and they go wash their hands, and then they start to leave, and oh, I think my hands are dirty, and they go back and wash their hands, and they keep going through this, and they can't get out of the house because they feel this need to keep going back and washing their hands. Well, now that's disrupting their ability to function. So that's what a psychological disorder is. It disrupts the person's ability to function. So when you see some of these behaviors or things like that, and you think, well, I have some of these, that doesn't mean you have a disorder. Okay, so we're going to look at studying psychological disorders, a little bit of history on that. We're going to look at 3 disorders specifically: anxiety disorders, mood disorders, and schizophrenia, and then look at a couple other disorders, and then briefly look at how gender and culture affect abnormal behavior. So what is abnormal behavior? Abnormal behavior is patterns of emotion, thought, and action that are considered pathological for one or more of these 4 reasons: deviance, dysfunction, distress, and danger. So those are the 4 Ds. That's our criteria for abnormal behavior. So there's a scale. There's what's considered normal, that's something that's common, and what's considered abnormal, that's something that would occur rarely. That's kind of how we get a criteria then for normal and abnormal, what's common, what's rare. So the first was deviance. Okay, these are behaviors or thoughts or emotions that are abnormal when they deviate from society or from cultural norms. So normal would be your concern when your friends are over there whispering. Abnormal would be your concern that strangers are over there whispering. Dysfunction is the next D. It interferes with daily functioning. So like I gave the example of going an hour out of your way to avoid train tracks, or somebody who's got a drinking problem and so they can't hold a job because of their drinking problem. Okay, that's dysfunction. It's disrupting their life. The next is distress. Generally, except for one disorder, which we'll go through later, people who are suffering from psychological disorders feel distress. And so there's behaviors or thoughts or emotions that cause significant personal distress. And so sometimes that distress then can lead to behavior that's self-destructive or even suicidal. And the final D is danger, when people exhibit behaviors or thoughts or emotions that are present a danger to themselves or to others, then that's the 4th criteria. All right, some of the historical perspectives, these are things you would not have to know for a test, but in the Stone Age, people were exhibiting abnormal behavior. They thought there were demons in them, and so they subjected people to a procedure called trephining, where they bore a hole in their skull so that evil spirits could escape. In the Middle Ages, people thought people that were behaving abnormally were possessed with evil spirits, and so they would perform exorcisms on them. In the 15th century, people that might have showed some abnormal emotions or behaviors were maybe thought to be witches. And so they were tortured or put in prison or even executed. One of the things they would do was take a suspected witch and put them in a chair at the end of a lever and dunk them into a lake and then pull them back up. And so if they survived and didn't drown, then they must have been a witch. And so then they'd either be imprisoned or executed. If they did drown, then they said, oh, I guess they weren't a witch. Oops, sorry. Then along came asylums. Now, after the Middle Ages, when these asylums came about, they were mental hospitals. And so initially, when these mental hospitals emerged in Europe, they were a place to treat people with these abnormal behaviors and people that were dangerous. It protected society from people who were dangerous. But eventually, the asylums just became very inhumane prisons. In the 1790, Pinnell and some others emphasized a model that was a medical model, a model of disease, that this abnormal behavior was a disease and needed to be treated. And that eventually led to modern psychiatry. When we look at the disease model, we do have to be careful, though, because if we're saying, you have a disease, then some people are going to say, well, I have no responsibility for my actions, then I can't help it, I have a disease. And also, if we tell somebody they have a disease, then things become self-perpetuating, and that could lead to worse problems. So on the one hand, it's good that we're saying, here's something that we can treat. Okay, we're not dealing with evil spirits and things like that. But on the other hand, we have to be careful of the effect that can have on people. So in modern psychology, we have the 7 major perspectives. Each perspective emphasizes some different factor that they believe contributes to abnormal behavior. But in practice, all of these perspectives overlap. So we have the social cultural perspective, where the problems are reflecting the cultural values and the beliefs. The behavioral perspective, where we're dealing with inappropriate conditioning. Of course, way back we had our chapter on conditioning. So people have been conditioned to have a fear or something like that. And it also has inappropriate modeling, because modeling was another way people learn things. The evolutionary perspective said there's some exaggerated form of an adaptive reaction. The humanistic perspective says people are suffering from blocked personal growth. In the psychoanalytic perspective, we talked about how the unconscious, unresolved conflicts affect behavior. In the cognitive perspective, that emphasizes faulty thinking. And so that's something that we can deal with in therapy when we realize how people are thinking about a particular situation, and we can help them understand and see how they're thinking and see the alternative way to think about that. And so that can be very effective. And then there's the biological perspective that, of course, we have problems with the brain, we have genetic predispositions, and we have biochemistry. And so biochemistry is something we see often leads to mood disorders, which we'll talk about. Now, psychologists use something called the Diagnostic and Statistical Manual of Mental Disorders. So when we look up, what kind of behaviors is a person exhibiting, we can look in the manual and say, well, these behaviors are symptomatic of this disorder, and here are characteristics of this disorder. So this has been revised over the years. So we're at the 5th revision right now. So the DSM-5 is the current revision. And so this has over 400 disorders, and it has 17 major categories. So this is the manual that psychologists use. And of course, when we're dealing with insurance companies, we have to provide a diagnosis, and this is where that diagnosis would come from. Now, when we talk about these disorders, we really want to be humane in what we're doing. We want to classify disorders, not people. So we want to say things like, here is a person with schizophrenia, instead of saying, there's a schizophrenic. Okay, it gives us a whole different connotation and bias towards that person. Now, I'm going to just show a list here. You don't have to worry about memorizing all of these. There's a few of these disorders we're going to talk about more in depth. Okay, but here's just some, different kinds of disorders: anxiety disorders, mood disorders, schizophrenia. We have dissociative disorders. Sometimes people have suffered something that's traumatic, or they're continuing to be abused in something, or they've experienced the death of somebody very close. And so they can't cope with the distress or the grief. And so they begin to disassociate from that experience. And that could lead to either having amnesia and forgetting everything, or disassociating to go back to behaving like a child. And so then they develop this alternate personality. So we have multiple personalities in a person. We have personality disorders, and we'll talk about those. There's 2 we're going to look at. One is common, might be experienced by teens or by people and one isn't so common and was very unusual, antisocial personality disorder. We have substance-related disorders. We're going to talk about that. In the current version of your book, substance disorders have been relegated to a different chapter. I think it was chapter 4 or somewhere around there. Might have been 5. But anyway, it's not in this chapter, but we're still going to talk about that in this chapter because it's a kind of disorder. And then we did talk about eating disorders, of course, sleep disorders, either insomnia where a person can't sleep, or hypersomnia where they're sleeping all the time. This is a way to deal with distress. We have impulse control disorders. So people can't control their impulses, One is kleptomania. Can anybody tell me what kleptomania is?
Is that one stealing?
Yes, that's where somebody has this compulsive urge to steal. And another impulse control disorder is pyromania. What's pyromania?
Is that one fire?
Yes, where a person wants to set fire and they get some kind of satisfaction from setting fires. And then, of course, another impulse control disorder is pathological gambling, where people can't help themselves and they just continue to gamble. All right, so there's a lot of different kinds of disorders. Of course, dementia and other cognitive disorders. And then there's some categories of disorders where we're saying this person exhibits these disorders, but it's obviously abnormal, but we can't quite find another place to put it in. So we have kind of a catch-all other conditions category. All right, so let's look back. I said there's 4 major standards for identifying abnormal behavior. What's one of those standards?
Deviance.
Deviance,
Yes. What's another standard?
danger,
Yes. Yes.
Dysfunction.
Yes. Okay, the 4 Ds. Deviance, dysfunction, distress, and danger. That's our criteria. Okay, what is it that provides detailed descriptions of the key symptoms of abnormal behavior?
The DSM-5?
Yes, very good. Okay. All right, so now we're going to look at some specific disorders. The first is anxiety disorders. Anxiety disorders are the most frequently occurring disorders, and they're diagnosed twice as often in women as they are in men, and they're among the easiest disorders to treat. Anxiety disorders also have the best chances for recovery. So these are what we see most often in the general population, is anxiety disorders. There are 5 major anxiety disorders. So on a test, I'm going to be asking you about certain categories, like anxiety disorders, a category, and then I might ask you about, tell me some specific disorder within the category. So within the category of anxiety disorders, we have generalized anxiety disorders, panic disorder, phobias, obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, which we've talked about before. So here's kind of a basic chart that shows generalized anxiety disorders. We have these fears or feeling of anxiety, but we don't necessarily have anything that's attached to. Now, all of us experience anxiety in one form or another, but for some people, that anxiety is so intense and so chronic, meaning it continues to last, that it seriously disrupts their lives. And it's common that people might have more than one anxiety disorder. Okay, another anxiety disorder is panic disorder. So sudden episodes where people are feeling dizzy or hyperventilating. There may not be an apparent cause, or sometimes there is a trigger. We have phobias, and under phobias, we have 3 categories. One is agoraphobia, being afraid of large open spaces, specific phobias where people are having a fear of certain things, social phobias where people are afraid of being embarrassed in public. We have obsessive-compulsive disorder, where people either have these thoughts that they can't get out of their mind, or these rituals that they feel they have to repeat. And then PTSD, we talked about that in an earlier chapter. So generalized anxiety disorder is chronic, means it continues. It's not something like, I'm feeling all this anxiety for a couple of days and then it goes away. They're continuing to feel this over time. And so it's uncontrollable. They have some kind of excessive fear or anxiety, and it lasts more than 6 months. And there may not be any particular object or situation that we can identify that's creating this anxiety. So it's called a free-floating anxiety. The second kind of anxiety disorder we said are panic disorders. So people have what we call panic attacks. Some sudden but brief attack, they may hyperventilate, they might become dizzy, they're very apprehensive. So something comes on suddenly. Third type of anxiety disorders are phobias. So sometimes it's natural to be afraid of certain things, but phobias are very strong, irrational fears. And so people really disrupt their lives in order to avoid some specific object or situation. And under phobias, we said there's 3 kinds of phobias. One is agoraphobia. So people have a fear of being out in the open. Okay, they might have a fear of that if I go out in this situation, I'm going to have a panic attack. So they don't want to be in either very crowded places or very wide open places. For some people, that might mean if they're going to watch a show, for instance, in some kind of arena or theater, when they get inside, they begin to have a lot of anxiety and they start looking for the exits. They want to know that if something happens, how am I going to get out of here? And so they have this strong fear. For some people, that's just a fear of being out in the world, that something's going to happen. So they don't want to leave home. Now, unfortunately, we were having problems trying to play a video through this medium, but usually I would play this video of a young lady who suffered from agoraphobia, and she talked about how she started to get treatment and got better, and then it got worse, and she wouldn't even come out of her room. She just wanted to be in her bed and sleep to deal with this. And along with her fear of going out, she began to suffer from depression and was displaying suicidal thoughts. But she found music, and the music helped her to cope, and it helped her to kind of open up. And so this was a clip of her actually getting over the agoraphobia to the point that she went on a stage on America's Got Talent and performed very well there. So that was interesting to see. And of course, Howie Mandel, who's one of the judges, suffers from OCD, and he talked about how when you have these disorders and you're getting treatment, it's not like, you're okay one day and now you're better and, life goes on. It's you have ups and downs, and it's a matter of, having the ups more than the downs, and, working towards that point where we rarely have those down periods. So that was a good example of somebody with agoraphobia. All right, then we have specific phobias. So people are afraid of some specific things. One very common specific phobia is claustrophobia. People have a fear of closed spaces. So they would have great anxiety to try to ride in an elevator. Somebody like that, maybe if they were going somewhere and stayed in a motel room, the first thing they would have to do was make sure that a window was open, because if the doors and windows are closed, then they feel that closed-in feeling and begin to have anxiety. So they want to feel that there's something open. Another common phobia is acrophobia. People have a fear of heights, sometimes to the point where if they were somewhere high and they kind of looked over the edge, they would begin to feel vertigo, which is like things would start to spin and they'd feel dizzy and have all these different kinds of symptoms like that. And of course, arachnophobia, which is a fear of spiders. So some people scream when they see spiders. There was a good movie called Arachnophobia. Should have watched that in class. All right, the third category of phobias is social phobias. So these are where people are afraid of embarrassing themselves. They are afraid of being embarrassed in certain social situations. So one of the most common phobias in the general population is a fear of public speaking. That's one of the most common things that people have a fear of is public speaking. They want to get up in front of other people. Another is a fear of eating in public. So they're afraid they're going to embarrass themselves by having, spinach stuck in their teeth or something. So some people don't want to eat in public or in front of others. Another kind of anxiety disorder is obsessive-compulsive disorder, OCD. Now, remember, something's a disorder when it disrupts your life. So maybe at your home, maybe you show some OCD tendencies. Maybe you don't like the towels to be crooked on the rack, so you feel a need to straighten up the towels, or maybe you want things ordered on your desk. That doesn't mean you have a psychological disorder, okay? You're exhibiting a little bit of wanting to have control in your life. But OCD is a disorder when it disrupts somebody's ability to function. And so they may have these persistent, unwanted, fearful thoughts. They're obsessions. They can't stop thinking about certain things. So that's the obsessive part. And then they may have irresistible urges to perform some repeated act or ritual. So those are compulsions. Okay, so they could have either obsessions or compulsions, or they could have both. And so the compulsions sometimes help relieve the anxiety created by the obsession. And so this is a picture of a movie called As Good as It Gets, where Jack Nicholson had OCD, and when he washed his hands, he'd get a new bar of soap, wash his hands, and then throw that bar away because he didn't want any transfer of germs. So he had a cabinet full of soap, and he didn't want to, step on cracks in the sidewalk and things like that. So he had these very disruptive behaviors. And then this waitress at a restaurant that he went to had a child that needed to go to the doctor, and he had a car, but it was all about him trying to get over this fear of being out to help her. So it was an interesting movie in dealing with OCD. In adulthood, OCD is equally common in men and women, but in childhood, OCD is more prevalent among boys. And the last anxiety disorder is post-traumatic stress disorder. And actually in the DSM-5, that's been moved out of the anxiety disorder category and into life disorders category. We talked about PTSD when we looked at chapter 3. All right, so why do people have anxiety disorders? Well, there are psychological reasons. There's faulty cognitions, the way people think about things, that they have these fears of things. And so when we help people see, okay, this is, what you're thinking about this, but what if, and we lead them to other ways of thinking. Another is maladaptive learning. So we said, when we saw like baby Albert, that you bang a pan and behind the child when you show them the white rat, and they become afraid of the white rat. So there's things that happen that cause people to then have these irrational fears. And then modeling, sometimes the people we're growing up with and we're learning by modeling, and that can create some problems also. There's biological disorders where, obviously fear is something that helps us survive. When you have a fear of, the tiger running at you, you run away. But maybe that stayed with somebody and it's over adaptive in some way. Genetics, we see some things that there may be genetic reasons people behave ways, and that can be passed on so that they don't necessarily get the disorder, but they have a genetic predisposition so that if other things happen, then they're more susceptible then to getting that disorder. There's brain functioning. So we can see all kinds of things, whether it's the neurological aspects of the brain, or sometimes brain injuries can cause people to behave in strange ways. Sometimes when people get something like meningitis, then that affects their brain functioning and they start behaving strangely. The biochemistry in the body, we know we have hormones and neurotransmitters. And so mood disorders are often an imbalance of things in the body. And so these are things that can be treated when we figure this out and help people to get that right balance of the neurotransmitters or the hormones, okay, to then get them having normal moods instead of the different kinds of things they have in mood disorders. And then there's social cultural things. There's environmental stressors that can affect people, whether it's divorce or loss or global pandemics, okay, that can cause people to be stressed. There's cultural socialization that people are taught to behave in certain ways and deal with certain things. So there's a lot of different explanations of why people develop anxiety disorders. So this is just kind of a chart of what I just said, that there's psychological reasons, either faulty thinking or maladaptive learning, conditioning, things like that. There's biological reasons, which may have evolutionary aspect that got passed down, or genetic predispositions, or biochemical substances in our system. And then there's social cultural reasons, that there's certain cultural pressures to behave in certain ways or to live up to certain expectations that sometimes people don't feel they can live up to. Okay, unmute your mic so you can give me a quick answer. In letter A, what category or what subcategory of anxiety disorder would be chronic excessive fear and worry not attached to any specific threat?
Genetic disorder or something like that.
Okay, it does have a G. Okay, generalized anxiety.
Okay.
Okay. What are recurrent episodes that cause us to be dizzy or difficulty breathing and comes on suddenly?
Panic disorder?
Yes. What disorder has 3 categories: agoraphobia, specific phobias, and social phobias?
Phobias?
Yes, that one should have been easy. Phobias. What disorder has persistent unwanted thoughts or repeated rituals?
Obsessive-compulsive.
Yes, OCD, obsessive compulsive disorder. And then what are anxieties from traumatic experiences in life?
PTSD?
Yes. Okay. All right. So on a test, then I would expect you to be able to name a disorder and then give some kind of specific example. Okay. So you have to come up with an example of somebody and how they would behave if they had that disorder. Okay. Mood disorders, there's a lot to mood disorders, and I want to kind of keep it all together. So I'd rather go a little further today, but because I want to keep mood disorders together and I don't want to go way long today, then next class we'll start with mood disorders and we'll actually finish this chapter 13, next class. So now, before we go, does anyone have any questions? Okay, so remember, if you
I have a
want,
question.
okay,
Sorry.
go ahead.
So can disorders like OCD like diminish with time? So like just get less prevalent in your life or no?
They can, and they can also increase. So it kind of depends. Sometimes, obviously with treatment, people can begin to cope with that, and that can diminish over time. So it is something that can diminish over time when people find different ways to deal with things. There was an instance, again, I tend to watch these, performance shows. There was a guy who had OCD so bad he couldn't leave the house because he had to brush his teeth, and then he had to brush his teeth again, and then he just couldn't stop. He couldn't leave the house, and it was crushing him. But then he adopted a dog from a pet shelter, and that began to bring him out, and he began to spend his time training the dog. So then his OCD began to subside, and he got out of the house and did things. So yes, it can subside over time if there's something to happen. For instance, somebody gets involved in something else, and it draws them out of that, or they get treatment. However, it can also get worse over time. So if somebody's not getting treatment and they're not finding something, then it could get worse because they have no way of dealing with it or coping with it. Okay, remember that I put up a question on the discussion board so you can have input into the next test. So you can explain why you think it would be good to have a longer test or a shorter test. So, don't just say, well, I think longer or shorter is good. That doesn't tell me anything. You want to explain why. Okay. Okay, you guys have a great day. Bye.
Bye.